Hi everyone, my name is Claire Cunnell and I'm the Service Lead for the Reactive Emergency Assessment Community Team, also known as REACT. We are part of the East Suffolk and North Essex Foundation Trust, known as ESNEFT. REACT cover the Ipswich and East Suffolk region. We are an urgent community response team, a UCR. We respond to people in crisis in the community, in their own homes and in nursing homes and care homes. We do this to avoid admissions to hospital and assist with maintaining and supporting individuals safely in their own environment.
Hi, I'm Catherine Rice, the Occupational Therapy Clinical Lead within the REACT team. REACT is a 24-hour, 7-day-per-week service. Core service is between the hours of 8 a.m. and 8 p.m. You can contact REACT via the Community Care Coordination Centre on 0300 123 2425. All calls are answered by a trained call handler who will transfer you to a REACT clinician for you to make a referral. The clinician will either be a senior therapist, a health and social care practitioner, or a registered nurse. They will triage your individual case and the clinician will be able to decide whether the referral is suitable for the urgent community response service or if it needs signposting to another service.
My name is Pia Hughes and I am a clinical nurse lead in REACT. Here is a short list of inclusion criteria. As a part of REACT, our nursing team delivers the antibiotic service in partnership with the OPAT team. REACT will also cover the extended district nursing service in Ipswich and East Suffolk during out of hours, including the late and night shifts. Typical referrals for our team during out of hours would include patients who have problems with their catheter, wound care, diabetes management, urgent bloods, and end-of-life care, which would often include pain management and support for patients and their families.
Hi everyone, I'm Mark Johnson, the Physiotherapy Clinical Lead for REACT. The UCR teams have access to a range of specialists, including consultant nurses and doctors, community nurses, senior nurse assessors, occupational therapists, physiotherapists, mental health nurses, health and social care practitioners, social workers, British Red Cross and Suffolk family carers. These teams assist people to remain at home during an episode of illness or during a social care crisis. REACT will contact and assess the patient within 2 hours of the referral. They will then support the patient for up to 5 days. The patient will receive ongoing monitoring and observations by either a clinician or with a remote monitoring device. The patient will receive treatment and reviews from the most appropriate professional to ensure that they remain safe and stable at home. If the patient needs assistance with personal care or have deconditioned following a fall or period of illness and are unable to complete daily activities of living, generic workers will start the reabling process.
If at any stage the patient becomes unwell, REACT will escalate this and coordinate a safe and appropriate transfer to hospital. REACT also assess whether the patient would benefit from a community rehabilitation bed if they are medically stable.
Thank you for your time and for listening to what REACT has to offer the people of Ipswich and East Suffolk community.